Uric acid is one of the most harmful chemical byproduct which is connected with the onset and progression of type 2 diabetes and cardiovascular diseases. While we all know that high uric acid level could lead to gout, and we generally check our uric acid levels via normal blood test, and when we have high elevated uric acid levels, we are told to avoid foods which are high in purine. But here we are missing two important aspects. First is, your uric acid is actually produced by your gut and oral microbiome, and if you could know these biochemical functions performed by these microbes living in your mouth or gut, you could actually detect the high uric acid levels even before it show up in your normal blood work. Second thing is that one of the core reason for high uric acid level is fructose. Now, your gut and oral microbiome could metabolize fructose and purines into high uric acid levels, right? And this high uric acid levels can actually suppress nitric oxide production. It activates NADPH oxidase, which causes oxidative stress, which oxidizes tetrahydrobiopterin, which is one of the cofactors for production of nitric oxide. And when we have nitric oxide deficiency, we cannot dilate blood vessels. We have hypertension, we have high blood pressure, which are the independent risk factor for cardiovascular disease. Even when we have nitric oxide deficiency, it does not, there is no signal to activate GLUT4 and, to enable GLUT4 to go to cell membrane, bind to glucose and clear it from the circulation, transport into cells for storage or energy. So essentially, uric acid, by suppressing nitric oxide production, actually increase their risk for type 2 diabetes and cardiovascular diseases, right? And we at GeneFreeletics actually measure your uric acid production via both gut and oral microbiome, and could tell you whether your microbiome is producing high uric acid levels, and then we give recommendations in terms of nutrition supplements that can modulate this pathway which is causing which is producing excess uric acid, right? And even in our detection models for type 2 diabetes and cardiovascular diseases, uric acid has the highest weight in terms of contributing towards the onset of these metabolic diseases.